Hello, everyone. Thank you for being here today. I'm Rose Gerber, the Director of Patient Advocacy and Education for COA. You're going to see today's chat agenda. It's going to be a refresher because I know we always have new participants, and in addition to our long-term incredible advocates, I'm going to start this off by giving you just a refresher about what our organizational focus is and also what CPAN's advocacy focus is, both at the national, federal level and at the state level. And then really the core of this chat for today is to give you a deeper understanding of what the Sit in My Chair event is. And before I go to the next slide, I think that you all know, those of you who've been with COA and CPAN for a long time, is that the main advocacy goal that we have is preserving the community oncology setting. Because for patients, that means that they have access to care that's local, it's affordable, and it's cutting edge. And part of what we do is we educate patients, also the providers, and certainly our policymakers about the value of community oncology. So go ahead and go to the next slide, please. So again, a refresher for those of you who may not understand what CPAN's advocacy focus is, it's to raise awareness on the value of independent community oncology cancer care centers and how national and local healthcare policies may affect patient care. And in really simple language, what this means is that we, COA as an organization and CPAN as the advocacy arm, we advocate for any issues that get between physicians and their patients, which often results in a disruption or a delay in cancer treatment, which no cancer patient wants and no caregiver of any patient wants. If you are faced with a cancer diagnosis, the last thing that you want to do is have any disruptions in your care. Next slide, please. So what I'm going to do is also remind everyone that what's really unique and I think special about COA and CPAN is that we are this large national advocacy organization that has a very strong presence on Capitol Hill. We also have our members who are these community oncology practice. And as I like to say every time, community means that it's an independent cancer center that's managed and owned by the physicians. And what we believe is so important to advocacy is making sure that we build these relationships all year round and also at the national level and at the local level. Next slide, please. So one of the ways we do this, of course, as I just mentioned, was having a very, very strong presence on Capitol Hill. And I did say very twice intentionally. COA last year celebrated 20 years in existence. And throughout that time, COA has increasingly gained a lot of stature, which benefits patients by being on Capitol Hill year round. And it's primarily our leadership, doctors, physicians, and most recently, we had our Spring Hill Day. And for any of you that follow COA on LinkedIn or any of the COA staff or just any of the COA CPAN advocates, hopefully you saw this picture or many pictures from our Spring Hill Day shared on LinkedIn. It was a very exciting day. And again, this is a perfect example of a timely event that shows how we advocate on Capitol Hill. Next slide, please. So when we were on Capitol Hill, we had a couple of asks. So anybody who works in the advocacy world knows that when you're going to a meeting, you want to make that meeting effective. We're not there just to chit chat. I mean, we're there to chit chat and build relationships, but we also generally have very specific asks. So I'm just going to read the high level asks here, what we asked for in terms of our advocacy requests. And then I know some of you will want to see our slides after, which are always available. Some of you like to just do old school and pull out your camera or take a screenshot. So feel free to do that. But the primary things that we asked for during our time on Capitol Hill was to stop CMS's restriction on how oral cancer medications are delivered. A lot of you like to know the bill numbers, so you can see that this is a support the Seniors Access to Critical Medications Act, which is HR 5526 and Senate Bill 3458. There's a lot of PBM reform happening on Capitol Hill, and you can see here that there's 3 different acts: the Lower Cost, More Transparency Act, which is HR 5378, modernizing and ensuring PBM accountability. Accountability is a huge issue with PBMs. That's Senate Bill 2973. And a third act is the Neighborhood Options for Patients Buying Medications Act, HR 5400 and Senate Bill S436, 2436, excuse me. And of course, tackling insurance abuses, because as patients know, unfortunately, I hate that patients have to know this, but a lot of times insurers, they have restrictive policies, prior authorization and step therapy. And I know especially for patients, step therapy is a huge trigger word. but what happens, that slows down treatment. So there is a Support the Safe Step Act. So again, if you want to learn more about these, here's the bill numbers. You can go and learn more about it. But this is what we did during our time in Washington. Next slide, please. And of course, pictures are the best proof that you actually were there. These are some of our advocates from Ohio. The group on the left, we also had representation from Connecticut. They're not in this picture. I had to just choose a few pictures. And on the right, these are advocates from New York, along with one of our senior staff members. And take a close look at the individual on the far left in the green. Her name is Chelsea Klock. She is a registered nurse and one of our chapter leaders from Hematology Oncology of Central New York. And we hope that she will be able to join us later on in this presentation. Next slide, please. Okay, so I'm talking about how we build relationships and try to sustain those relationships, both at the national and local level. So many years ago, COA developed a formal program called the Sit in My Chair event. And the Sit in My Chair event is a very unique event, and I'm going to explain to you why. Let's go back to that photo that, I don't mean we have to technically go back to the photo, but I just showed you a picture of our advocates in Washington, D.C. And for those of you that are active with other advocacy organizations, this may be a familiar photo. So, we're not the only group that goes to Capitol Hill, all different types of organizations, not just disease specific, of course, go to Capitol Hill. The event that I'm talking about now is an exclusive event that we do to maintain our relationships at the local level. And what we do is we created this event to give our policymakers the opportunity to have a better understanding of the value of community oncology. So when we were on Capitol Hill in May, we had our patients and our survivors and caregivers there talking to our leaders, telling them what it meant for them to be treated in a community setting, the positives. And then they also talked about a lot of their frustrations on some of the issues that I just addressed, step therapy, prior authorization. So of course, they're hearing what they say and they're very respectful. But again, there's nothing like actually having that experience of going to a cancer center. So in a sense, when we're in Washington, we're kind of setting the stage to say, we're going to invite you out to our practice and really give an example of what it means to have a patient experience. So these representatives, primarily during the August congressional break, which is the federal, when the federal lawmakers are back in their district, the states have a slightly different calendar. We bring them into the practice and really put them through a mock experience of being a cancer patient. And the result, we hope, of all of this is that they do gain a deeper understanding about the patient experience, about the value of community oncology. And of course, we want them to understand that this type of care in this type of setting is often obstructed by PBMs and insurers. Next slide, please. So part of the main reason for this webinar today is to encourage our community practices to host a Sit in My Chair event. And for those of you who are patients that might be, or even providers that might be in a setting where you don't have a CPAN chapter, you don't have to have a CPAN chapter to execute this event. This is a COA-wide event. And I'm here to tell you that this event is a very impressive event, but it's actually very easy to execute because we try to do as much work on our end to make it very easy for you to have this event at your practice. So what you do before is you're going to invite your lawmaker to your practice, and you can identify your state and federal representatives at openstates.org. So of course, we're not going to go into that now because you have to go into your individual state, but this is where you can find who you're going to be reaching out to. And again, many of our practices already have great relationships with their local and federal representatives. So that's great. You're going to be able to choose whoever you want to reach out to. And then you plan your visit. As I mentioned, the August is generally when we do this event because that's a congressional recess. The state calendar varies. However, we do, though our preference is to do it in August because that's where we have a very high success rate. There are times when we've had a representative say, well, this time does not work for me, but I really am excited about this event. So can I come to your practice at another time? So of course, we really push for August, but we're open to obviously other opportunities and dates that might work for them. Next slide, please. Okay, so what happens on the day of the Sit in My Chair visit? So now that individual has been identified, the lawmaker is going to come into your office, and ideally by this time you've identified a couple of patients that might want to join you on this mock event, and have some providers from your staff walk this congressman or their representative through the experience of being a patient. So when we say they go through a mock cancer treatment, they are not treated in any special way. They come into the waiting room and they sit down in the chair, just like anyone who's been a patient has to go through. They go up and check in with the receptionist. They're brought back into the area where the patient experience starts. They go through a mock experience of setting up an IV and sitting in a chemo chair. And of course, I want to emphasize, especially to the patients, that there's in no way ever going to be the actuality of what any of us as patients have experienced. So we're not trying to do that, but we're just trying to give an understanding. It's one thing to look at a chemo chair, see pictures of chemo chair, but when we have our policy leaders actually sit in a chemo chair, it does really hit them that, wow, this must be what it's like. And unlike the policymakers who are going to be in those chairs, they can get up in a few minutes. For any of us that have been through chemo, we've sometimes sat in that chemo chair all day, but it definitely makes an imprint on them. After they've gone through that mock cancer experience, we recommend that your select staff, which can be physicians, nurses, social workers, pharmacists, financial counselors, do a walk through the practice just to kind of make that lawmaker understand and see all the attributes of your community oncology practice. So that's the tour part. And on a personal level, many, many years ago, before I was formally working for COA, I had this experience with Congressman Courtney in Connecticut, and it was a really incredible experience for him. And this is experience that will happen if you host this event as well. Next slide, please. Okay, so now we've had our policymakers go through this mock visit. We've given them a tour of the practice. And again, every practice is going to do this a little bit differently. But what generally works is if you have a little conference room or a little, space in the waiting area, somewhere quiet, we are actually going to have a specific ask. So these are going to be the asks, and we can provide this for you on a leave behind, what we call leave behind, something that you could give to them. I guess we should say it's a go away piece. Leave behind is when we're visiting them. So basically, we're just going to say this is what we're asking for. We had you here today because we're trying to show you what patients value about being treated in this type of setting, and also what the providers value by working in this type of setting. And this is what we're asking for. We're asking you to support policies that support this care setting. So the three highlighted ones are, we want you to ensure that independent community oncology practices can stay open for patients. And again, in this first sub-bullet, I'm just going to read the first sub-bullet. I'm not going to read them all because, again, you will have access to the full slides on our website. Patients' ability to get the care they need can be negatively affected by inadequate physician reimbursement. And I've addressed this topic about physician reimbursement before because it's very easy to, you hear the word, physicians getting reimbursed, and it might make you feel very uneasy. That would be a natural reaction because a lot of times people think there's nothing but rich doctors out on yachts. The reality, and we do try to teach you this through COA and CPAN, is that a cancer center is a business. Okay, you want your medications to be refrigerated. You want to have a functioning chemo chair. You want your staff to be paid. So again, in addition to understanding the patient experience, our lawmakers understand the value to their constituents of having this community practice in their event. We're going to be asking them again to stand up to the PBM abuses that harm patients. So when I showed you that first slide, we talked, and for those of you who joined us on Hill Day, there's a lot of momentum right now about PBM reform. So we're using this opportunity now to follow up on what we asked them to do in Washington, get a hold of the PBM issues that are hurting patients. And again, we want our lawmakers to help us protect patients' access to life-saving prescription medication. And again, you're hearing this over and over and over. PBMs interfere and delay treatment for patients, and we don't want that happening. This is a great slide if you want to print it out or save it later, take screenshots, whatever you want to do. Next slide, please. Okay, so what do you do after the Sit in My Chair event? Follow up with thank you and emails. It's really remarkable. It's just, this is one of my pet peeves. It's just in the business world, it's so easy to forget to have the courtesy to send a thank you letter or thank you email. This person made the time to come out to your practice, to learn all about your practice, and these are high-level individuals. So I know, common sense should say we're going to follow up with emails, but I know what happens if people get very busy after. But this is a really critical part of sustaining and building a relationship. So please don't forget to do your thank you letters and emails. And also, we COA CPAN are able to assist you with any template letters that you can customize again for yourself if you would require that. And if you do have a staff member who would be willing to take some photos, you don't have to have a formal photographer and pay tons of money. We all have iPhones, and or sometimes people have like great cameras. It's a great opportunity to take pictures, and you can even invite members from your local press, because this is a really prestigious event that our lawmakers enjoy participating in. Next slide, please. Okay, so now I'm going to give you examples of successful sit in my chair events. Next slide, please. So this is New York Congressman Andrew Garbarino, Republican from New York, who is participating in our sit in my chair event. Now, as I mentioned, they actually go through the experience. So you can see, the IV, sitting and talking to the doctor, sitting in the chemo chair on the far left. Of course, you see at this time, these pictures were, this particular event was done during the COVID era, but this is really, truly a mock patient experience, and it makes a tremendous impact on how our lawmakers understand the patient experience. Next slide, please. This is our Florida practice. Florida Cancer Specialist has always done an outstanding job in participating in our sit in my chair events, and they just do a great job overall in so much of our advocacy work. And this is Florida Congressman Gus Bilirakis, a Republican from Florida. And again, you can see different state, but we have a pretty standard scenario of how we put the lawmaker through the experience. So you can see here, even on the top right photo, he's getting exposed to the imaging, and to have this type of imaging in-house is a really big deal. So they're getting to see this firsthand. It's one thing to hear about it when they're hearing it from it in Washington, D.C., but to come into the practices and see this is really incredible. Next slide, please. Okay, and another Florida Congressman, Ted Yoho, a Republican from Florida Cancer Specialist, with the sit in my chair event. And again, you can see them even getting the little patient tag that we all get when we sign in, talking to nurses on the bottom, and talking to Dr. Gordon on the far left, top right, far left. Okay, top photo. Next picture, please. Next slide. Now, so we've had all this momentum of going to Washington, D.C. I showed you some pictures of, the sit in my chair event locally. But we also understand that we have to always maintain our relationships with the state level, and of course at our practice level as well. Next slide, please. Next slide, please. Okay, so let's go back one slide, please. Okay, so before I turn it over to Chelsea Klock, who's one of our leaders, who's going to talk about her personal experience as a leader executing this event, I did want to show you, I can't have every leader on here, but I did want to show you that several of our other practices, I've addressed Florida Cancer Specialists, our practice in Indiana, our practice in Ohio, they've also held this event. And the previous slides that I showed you had our actual congressmen, but you can also have state representatives or just a representative. It's not in any way lesser than having the actual congressman come out. So again, just showing you that this has been done by many of our practices, and this is just a sampling. So next slide, please. Now, the person I've been talking about, Chelsea Klock, again, is I'm so happy to have her as one of our long-term CPAN chapter advocacy leaders from Hematology Oncology Associates of Central New York. And for those of you who are with us at the very beginning, I showed a photo of some of our advocates on Capitol Hill, and I worked with Chelsea to help me identify patients to go to Capitol Hill. So she's had the experience of Capitol Hill to being a leader at the practice level. And now Chelsea's going to give us some insight into how she's run this event for more than 1 year. So thank you, Chelsea.
Thank you, Rose. My name is Chelsea. I work for Hematology Oncology Associates. We're in upstate New York. We have 3 practices, or 3 offices rather, and we have done, oh goodness, I mean, I think at least 10 plus of these events. They're just really great events. So if you can go to the next slide. So this is actually one of our New York senators, John Mannion. He is actually one of our patient advocates, knows him personally. So this was a great opportunity for her to kind of put a plug in and invite. And as soon as I invited him, he was more than willing to come to the practice. And you can see, as Rose was talking about, he came in and he knew some people in the waiting room. He chatted with them. He went all throughout our building as a new patient. He had the opportunity to meet with various different areas in our building. He met with our health equity coordinator in the middle there. And then he had the opportunity to come down to our patient pharmacy. and speak with our pharmacist about PBMs right in the pharmacy. So I think that's very impactful for them to see the ground level, where we are, what we're doing, and to speak to the pharmacist directly about the struggles that we have at our practice. Next slide, please. And these are some other events. So the picture on the left there, we had someone from our federal Senator Schumer's office. She brought a couple of her interns, so there was a group. And we always have, when we do these events, we always have a patient advocate who comes along and gets the opportunity to share their personal insight and how their process was when they were going through cancer, firsthand. I think it's quite impactful to just have that firsthand account, and it's good for the advocate to be able to share their story, and it's good for the representative to hear the story as they're kind of progressing through the building and seeing the different aspects of care. And then on the other side there, we actually invited the deputy mayor to come, and it was quite impactful for her. She's actually holding the very famous bag of drugs there. In our pharmacy, we get a lot of people that return drugs because of the PBMs and mail order pharmacies. We end up with a lot of waste, and you might not necessarily see that. So patients will bring their drugs back into us for us to dispose of, and we're keeping track of them to see, just to show the tangible physical waste that is happening because of the PBM. So for her to be able to see that bag, I think there was $100,000 at least worth of wasted drug in that bag, completely unopened, that were sent to the patient and just not in real time because they had to go through mail order. So that was quite impactful for her. So I think that was the ability for someone to come in and be able to see, these firsthand accounts, to talk to patients, to see what we do in the community, I think is super impactful.
Chelsea, I'm glad that I'm glad that you call that the famous picture, because we have used that photo on the right multiple times, because it is such a powerful visual. Again, these PBMs, they're just mailing out the drug without even talking to the patient, and it's a staggering amount. When you look at that amount of money that was just wasted, $100,000, and that's an estimate, it is truly mind-boggling. So be prepared to see this picture for a very, very long time going forward.
Yeah, so we've had great experiences with everyone that we've come in has really said that it opened their eyes to different things that they hadn't necessarily considered, and I don't think anyone left without a little bit of an impact from coming to the practice, for sure.
Chelsea, can you talk about what, you are a chapter leader, you're a working nurse at the practice. What did you have to do to kind of get buy-in from your senior leadership to make this happen? Because I do know it's very natural for people to overthink this. I always tell everybody, stop overthinking it. This is easier than it may seem. So what advice can you give to our other chapters or practices that want to do this, but think it's going to be too overwhelming or too difficult?
Sure. I would say it really is simple. These are things that you do every day, so you don't have to do too much prep for it. You're basically treating the representative as a patient. So this is the things that you do on a normal basis, and it's a good opportunity for you to highlight your practice and all the work that you're doing in the community. I think, once you get someone to come, it's really simple from there to have them just be a part of what you're already doing. And you can pull in, I like to get as many people from different departments involved as I can, because they're the ones that know, like our intake specialists, they're the ones that deal with the insurance all the time. They have the best insight. Our pharmacists, they have the best insight when it comes to the medications and all the hoops they go through to get drugs to patients. So if you can just allow people to talk about what it is they do every day, then that you've got it down.
Hey, Chelsea, and also, I opened up this presentation talking about the importance of relationships. And then you mentioned that you had was it a patient or a staff member that had a relationship with one of the lawmakers? There's so many ways to reach out to them. Like, obviously, we're saying there's a formal way with a template, but forget the formal way. If you do have contacts, this is a great opportunity, pick up your phone and start calling, because they really do love coming into the practices. Anything else you'd like to share, Chelsea?
No, I just think it's a little intimidating at first to try to come up with it, but once you do your first one, it'll be easy from there. You'll do several more.
I think you have to put forth a challenge, because I know that your practice has done it for at least 10 years, 10 times. And I know Florida Cancer Specialists in Ohio. I think we got to get a little competition going, which we did have at one time several years ago. Thank you, Chelsea. Next slide, please. Okay, so thank you, Chelsea. And hopefully all of you that are on the call today are signed up to get our CPAN news bulletin, which was released on Monday. There's additional information about the Sit in My Chair event, including a link to download the PDF, which has a little bit more information. And don't worry, it's not too long. We try to keep it simple. You can also go to COA's website, go to CPAN's website, go to the Education and Publications tab, and you will find Sit in My Chair, where you can read about it. And I think this is an incredible opportunity, and we'll hope you'll join us in August to do this event. Thank you for being here today as our listeners and viewers. And Chelsea, thank you for being here. And as always, thank you to Drew Lovejoy, who's our man behind the scenes, who makes all of this possible as well. Thank you, and enjoy the rest of your day.